Certain group of workers in Riverside County are being warned to be cautious on the job. A respiratory disease called valley fever is on the rise, and the illness can happen just by inhaling dusty environments. So far in 2025, there's a 58% increase in the area compared to this time last year.
And we are joined live by Barbara Cole, the Director of Disease Control for Riverside University Health System. Thank you so much for being with us this morning.
Thank you for having me.
Yeah, we talked about how big this increase is. First off, what is valley fever? Because a lot of people haven't heard of it. And why are we seeing this huge increase in cases?
Well, valley fever is a fungus that can be in the soil, and when the soil's disturbed, dust storms, people doing construction, people can inhale it. So it can result in respiratory illness.
Okay, so you said people in construction, are there other people who are most at risk here?
People in construction, firefighters, but it could be people doing landscaping at home, any activity that increases dust in the air that people can breathe in.
Okay, so are we seeing the increase because there's more people doing construction, or how is the numbers making sense here?
Well, you mentioned the 58% increase. We think it's attributed somewhat to changes in weather patterns, drought, hot, rain, things that can allow those spores to grow, and then the soil is disturbed and people can inhale it. But also, I think there's increased awareness of the public, so they might present to their doctor for care, they evaluate them, they test for different things, and valley fever is one of the things that can cause respiratory illness.
Oh, interesting.
Got it.
And so the symptoms look like the flu, I'm told. When should people get tested or see a doctor?
Well, it could be flu, it could be like pneumonia, so when they're having ongoing cough, respiratory problems, chest pain, fatigue. If it doesn't clear up with the follow-up their doctor does, let's say they're thinking it's a community-acquired pneumonia, they treat with antibiotics, they don't get better, then the physician would be the one to determine what next steps to take. But testing for valley fever then would be on their differential diagnosis.
Gotcha, okay.
And for those who do spend time outdoors or in dusty areas, as you talk about, raises that risk, can you do anything to lower your risk?
Well, some of the things could be, number one, I would say people who are sensitive to poor air quality, as much as possible, they would want to be indoors when there's dust storms, those types of things. So trying to reduce dust exposure. They could wear a mask to help protect themselves. If they're themselves doing landscaping, you can wet down the ground before you rake or dig up things so that you don't have dust going into the air. Ultimately, people who are sensitive to poor air quality want to stay indoors as much as possible during that time, have their air conditioner on, have the windows closed.
So can you talk a little bit about, is this seasonal? Is this like the flu? Is this something that we'll see go away if we get this rain that we're talking about later this week, or how will that work?
We see valley fever throughout the year, so there's not a valley fever season where we think about respiratory illness season being the winter months, fall months. It can happen anytime, and we monitor that because it's reportable from our healthcare providers as well as laboratories, so we see it throughout the year.
Okay, and most people who get this, do they recover just fine? Do they need treatment from a doctor? Because I'm wondering, like, if I'm coughing, would I even go to the doctor to figure out I have valley fever, or is it so bad that you do end up going to the doctor?
Well, most people have mild illness that may not require them going to their doctor, but when the cough, the respiratory symptoms don't clear up, that's a sign they, at a minimum, should call their healthcare provider to describe their symptoms, and the healthcare provider would then advise them to come in and what next steps to take. So it can be very serious in some people, those with underlying health problems, those who are immunocompromised, those, let's say, who have asthma or COPD, they want to be extra careful and check in with their healthcare provider.
Okay, well, this is very helpful, and glad to hear most cases are mild. Barbara Cole, thank you so much for being with us this morning for that information.
Thank you for covering this important public health topic.